This is Laura Dierda with the Becker's Ambulatory Surgery Center's podcast. I'm thrilled today to be joined by Dr. Michael Flierl and Amie Henrichs, Executive Director of UnaSource Surgery Center in Troy, Michigan. Dr. Flierl and Amie, it's a pleasure to have you on the podcast today.
Thank you for having us.
Thank you.
Now, I know we've got a lot to talk about, but before we dive into my questions here, I was wondering if you could tell me a little bit about UnaSource Surgery Center and some of the great things that you've been doing there.
Yeah, sure. So UnaSource Surgery Center we have 5 operating rooms. We opened up for business in 2004. We've evolved tremendously over the past almost 2 decades. We are, at this point, about 90% orthopedics. We are multi-specialty. We do general surgery, plastic surgery, urology, ENT as well. We are very, very busy. We are very progressive. We have fabulous leadership here, and we're always looking for new ways to evolve and adapt to the healthcare climate to survive and thrive.
I'm a hip and knee replacement specialist, and I've been coming to UnaSource for probably 4 to 5 years, and we've really grown from doing the occasional outpatient joint to now being the biggest outpatient hip and knee replacement center in the state of Michigan, and it's been really phenomenal to be on this journey together.
Well, that's fantastic. And I'm excited to learn more about the surgery center and the different programs you have there. So the first question I have for you both is, where do you see some of the biggest opportunities for your ASC to grow and develop over the next year or two? I know robotics is a big part of it, and I'd just love to learn more about that.
I'll start with that one. So, yeah, robotics is definitely something that is changing our business, and it's proven to be a tremendous opportunity, I feel, for ASCs. We have had robotic technology here at UnaSource since 2016. We were one of the first in the country to partner with Intuitive for general surgery and some of the procedures with that. Patients are seeking this out. There is data that shows improved outcomes, shorter stays, quicker recovery with robotics, and we were very pleased to be able to bring robotic technology to our orthopedic service line, specifically with total joints this last year. And same thing that you're seeing is patients want this, patients are seeking this out. There are opportunities for improved outcomes, and it's a great opportunity for the surgery center.
I can certainly second that. I think that there has been a tremendous outpatient shift in the world of orthopedics, and I think this is a trend that will continue. And like Amie was saying, patients are seeking it out. They're asking for it. They've heard about it. They may have had a friend or neighbor or family member who has had robotic-assisted surgery, and they want to be part of it. And while the true long-term outcome data are still pending, and we don't know when and how this will ultimately really transition into an improved outcome and world, longer implant, longevity, etc. I do see this anecdotally that it does make a difference. And so a happier patient is really what we're all striving for in the end. So I think it's here to stay for sure.
That's great to hear, and just so interesting to think about the journey that you've had over the past several years with the robotic technology. What other interesting new technologies and platforms do you see as being really crucial to the surgery center's growth and development over the coming years?
I think coming again from a surgeon's perspective, there are numerous platforms out there now that help us really individualize a hip and knee replacement. So that's certainly something that patients are becoming familiar with and ask for it. I do believe that there have been some phenomenal technologies and platforms that have become available in the spine world that really allow spine surgeons to place pedicle screws percutaneously, no longer having to really perform large dissections in the neck or lower back area. So I think that's really fantastic technology. And then I think there's certainly also a pretty hard shift in the general surgery world to perform elective hernias or cholecystectomies utilizing the robot more and more.
Got it. That's really great to hear. And, I know you've gotten some great experience with bringing in some of that technology and really seeing it effective for your patients as well as to drive business. I'm wondering, for surgery centers that haven't jumped in incorporated robotic technology but are thinking about it, do you have any advice for them, and how to get started with that type of program and really take that leap into robotic technology in the ASC?
First of all, just doing the homework, right? I mean, ASCs are typically for-profit business. It's got to make business sense for your organization, and there are a lot of different ways and creative ways that vendors can work with small businesses to get the technology into their centers, and you can make it successful. Making sure that you've got committed medical staff that are going to use the technology and will be committed to it, getting it not only approved and brought into your organization, but then implemented and then going through the learning curve and sticking that out to make sure that it becomes hardwired and part of your business. And just, keeping track of the numbers and, making sure that it does fit, and it can fit, and it does work. Knowing that, there's sometimes they have to spend money to make money in these businesses, and that the cost of the technology and getting that in is going to be, you're going to make that up with the increased demand and the patients that seek your organization out and your surgeons out because you do offer that technology. And it's something that the sales folks will tell you, but it is true. We've seen it now twice with the two different, robotic platforms that we've introduced here, and both times it's the reality. Patients want it. It is a good marketing tool.
I would second that. I think the numbers are important. So if you're in a small surgery center who does, say, 20 joint replacements a year, it might be something you want to think long and hard about. But if you have a fair amount of joint replacements happening at your surgery center and you're looking to increase that business and you have surgeons asking for it and you really feel like that's the direction you want to go, I think it would be a great opportunity. The other thing is I think you have to understand where your market and where you are at regionally. So, in a highly competitive market, it may really help set you apart from other surgery centers or even hospital systems. If you are in a large city where everybody and their neighbor has a robotic system, it might not be quite as helpful and might not be a smart business decision. So I think there are a lot of factors to really think about, and like what Amie was saying, as a surgery center, the financials are certainly crucial, and you have to make sure it makes sense. But again, there are pretty creative ways that the industry is usually working with us and trying to figure this out, what makes the most sense for both sides.
Got it. That's really helpful to know. And I have one more question here before we wrap up our conversation. Obviously, the past few years have been really dominated in the healthcare space and really overall by the COVID-19 pandemic. What do you think the lasting legacy of COVID-19 will be on orthopedics and ASCs in general?
I think what we've seen in the world of orthopedics is really that the already beginning shift into the outpatient world has really been accelerated tremendously by COVID. Patients were afraid of COVID. They didn't want to go to the hospital. They didn't want that exposure. They didn't want their loved ones to be exposed to the hospital environment, a potential COVID infection. So I think it had started obviously before COVID, but really since COVID, we've seen a tremendous speed up of that process. So patients seek it out. They want it. They see it as a very viable option. And I think the other thing is the more patients have had outpatient surgery with a good result and a good outcome and had a good experience, that then certainly is being shared with neighbors, friends, gym friends, or whoever else. And so now the word gets out and patients are actually seeking this out. They don't want to go to the hospital anymore. They want the experience that their friend or loved one had. And I think that really underscores how successful we have been able to transition the care from the hospital into the outpatient surgery center and be able to do so safely and efficiently and also more cost conscious for the patient and for the insurances.
I totally agree with everything that Dr. Flierl just mentioned. In some ways, COVID has been, if you will, a blessing to our business. But more than that, not just always the bottom line, the way that we have, UnaSource has been able to help take care of our community and our medical staff providers in our community when during this whole pandemic we could be there, we could provide alternatives to the hospital, and it's been a ride, that's for sure. But and ultimately that has benefited the center.
Well, that's great to hear. Dr. Flierl, Amie, thank you so much for joining us on the podcast today. This has been a really fascinating discussion, and I look forward to connecting with you again soon.
Thank you for having us. This was great. Thank you.
Thank you, Laura.